Hi, welcome to this week's With Liberty and Justice for Some. I'm Congressman Mark Pocan.
Healthcare is one of the most significant challenges that people across the country face. If you don't have health insurance, you literally are risking your life every day, and you're one sickness away from bankruptcy or worse. If you do have insurance and it's not a good plan, then you're risking going broke or never coming back financially. And the quality of care can even be questionable depending what type of plan you have. And even if you have excellent health insurance, out-of-pocket expenses and deductibles can eat away at your family's budget. We're the only industrialized country that does not have universal health care. I mean, just let that sink in. The only country, as rich as we are, that does not have universal health care. And yet we still spend 30% of total government spending in health care and almost twice as much on health care as other wealthy nations. Why? What is good health care and why don't we have it? So with us for our one question today is Lori Wallach, who is one of the leading experts nationally on trade, a friend, as she's the director of Rethink Trade, the program at the American Economic Liberties Project. So Lori, welcome.
Thank you very much.
So my question for you is, if you had the ability to change any one federal law, it doesn't matter if you have majorities or whatever, you have the ability to do it, what would that one law be and why?
So there are a lot of them I'd like to change, but I think to avoid saying anything too stupid, I better stick near to trade, even though there are a lot of other things that really are aggravating. One law that would make a huge difference in everyone's life is to change a law that's called the de minimis trade loophole.
Yep.
And this is a law that basically allows imports, now 4 million packages a day, uninspected, untariffed, mainly the stuff we buy online, mainly from China. It's super dangerous because, number one, it's allowing in fentanyl-laced pills, products that are totally fake, like, bike helmets that are made out of paper mache, not actually safe, kids stuff that is made with lead, so it can really hurt your kid. There is a huge amount of endangered species products. Forced labor goods are sneaking in that way that would otherwise be banned. So it's a bad thing for consumers and all the people of goodwill and faith. But also it totally screws over Main Street retailers. Because like if you're a bicycle shop in Madison and you end up importing a couple of bikes, most of them are now made outside the US, you're going to pay tariffs on them, not even the penalty tariffs, just regular, like normal, it's part of your business. Versus if the thing is sold online because of this loophole, the loophole makes me the importer versus the company sending it. So Amazon never hits a limit, which is supposed to be $800 per person a day. Right. So it means they're basically dodging paying any taxes. So they should be paying taxes also to support our schools, our roads. Amazon makes a gazillion dollars. But also they're not paying the same tariff. So the local retailer gets totally stuffed. Plus, it's a way to cheat domestic manufacturers because basically the domestic manufacturer is paying all the fair wages, taking care of the environment, doing all the things we want to have something made in our country. But the stuff that's coming in could be dumping toxics on the ground, have no labor standards, and you don't know where it's from because none of the normal customs rules apply. So you're not even sure what it is and where it's from, which is why all this dangerous stuff gets in. So that would be a change to what is called Section 321 of the Trade Act of 1930. Just in case you've got your magic wand, Congressman, please aim at that law. It's a small thing, but really impactful.
Dr. Singh is a gynecologist, oncologist, that's tricky to say, in the current president of the Physicians for a National Health Program. She's practiced for 25 years and she knows what she's talking about. And she's made her passion for at least the last 17 years, making sure that we have healthcare that works for everyone in America. It's an honor to have Dr. Singh with us today. Welcome.
Thank you. And so excited that you want to talk about this issue. It's so important. And it is so crazy how we do it in this country.
Yeah. So let's start just real quick for people. Tell us a little bit about your background and what brought you to be the president of this great national organization fighting for universal health care.
I'm a gynecologic oncologist. So that's ovary cancer, endometrial cancer, cervical cancer, uterine cancer. And early on, like when I was in medical school, a little baby doctor, so to speak, it was clear like that we didn't do something right, that people weren't getting the care we need. That was the early 90s. And so I thought, like, you know what, science will help this. So I decided to get my doctorate in public health and cost analysis, because I was like, if we just did it efficiently and we had the right science, we could do this. And as I got into that, it was really clear that it wasn't that.
Yeah.
That it wasn't that we weren't doing it efficiently. It wasn't that people were wasting money. It wasn't that it was that we were wasting money on profit. And it really had nothing to do with cost analysis. And I actually never ended up doing cost analysis after like forever working on my dumb PhD, because the data was so bad. Like in America, it's really hard to figure out like how much does a hysterectomy cost? We don't know. Almost these insurance companies over the years made up costs to get hospitals to pay them the most possible. And so I don't know. So that was the beginning of me thinking through, what can we do to take care of people? And it's just gotten worse and worse, I think, over the years. Like now when I spend days being angry at insurance companies because they won't let me get the right test or they won't let me give the right medicine, and I'm just pissed off.
Yeah.
Being involved with PNHP makes me feel like, okay, I'm helping solve this problem by talking about healthcare, by talking to people like you who are the people who can change things in America. And then by talking to regular people about why it's kind of crazy that in America we think it's reasonable that people make money off people getting cancer, and that people like make profit off essentially like the worst day in someone's life. Yeah, no, and it's not quite enough. Like it's still tough to be a practicing physician and know that in another country somebody would get better care. Yeah. Although like we have the best hospitals, we have the best science, but somehow like we just can't translate that to helping people the way we should.
Well, let's take it to the big question then. Why don't we have universal health care like every other industrialized nation literally on the planet?
So that's an easy question and it's a hard question. I'm gonna answer the easy question first.
Okay.
Because we let people get involved just to earn money. And we decided that healthcare should be a for-profit business. Mm-hmm. And then the long question is, we could have and there's books written on the history of how healthcare evolved in America and what we did right and what we did wrong and blah, blah, blah. I mean, to me, the bottom line is we accepted that healthcare should be a for-profit business, mm-hmm. and it's just become more and more and more of a for-profit business. And we accepted in America that this is not something everybody deserves. And that just doesn't make any sense, and there's so much stuff that's gotten messed up by this. But literally today I was talking with one of my nurses and she was like, I think somebody, I'm talking with this patient and I'm trying to schedule a PET scan. And I think she thinks she's getting like her nails done because she's kind of trying to do it when it's convenient. Yeah. And I said, well, but you got to give her credit that the truth is when there's an insurance company that may or may not pay for it, and then when we're willing to wait 3 weeks for prior authorization and every other thing under the sun, like we convey the same message that maybe it's not that important, right? Yeah. And so people do sort of not think that there's a science behind all this. I find it kind of fascinating, and I'm not surprised that someone like RFK Jr. is now in charge of, Health and Human Services, right?
Boy, that's another program.
but I mean, but it's like an extension of, if you turn it into a for-profit business, is it really just to take care of people? Is it really just to give people the best, longest quality lives? Or is it some kind of pseudoscience, some kind of weird stuff, and we don't have to, have books written about it. We don't need articles. We just decide that we think something's good or bad. And I don't know exactly. I don't know personally, obviously, Robert F. Kennedy Jr., but how he has come to his conclusions that are so, science-free, and how he's allowed to take every vaccine expert out and put crazy people in who don't believe in science. And so, like, what are they basing it on? What are they basing the recommendations they make on? Yeah, it's a little bit nuts.
No, this is what I go through pretty much every day that ends with a Y with this new administration. So that's difficult.
I'm sorry.
No. Let's focus on the profit, because I agree. I mean, I think that is probably the single overriding problem. But where, just so people can understand, where does profit occur that takes away from healthcare occurring?
So profit occurs at every single step of healthcare. And most of the best studies say that somewhere between 30 and 35 cents of every healthcare dollar is profit. That means profit and bureaucracy administration. And so if we think about, places where all the money that goes into the system actually takes care of people versus, no, we're putting money into a shareholder's pocket. So that's where it happens. But it's every level, every blood test, every pair of crutches, every medication, every hospitalization, everything you ever spend on healthcare, some percentage of that, somewhere between 20 and 40% of that is profit.
Yeah.
And I mean, even in America now, hospice is for profit. And as an oncologist, I'll just say, there are so many great people doing great work in hospices, but by and large, they're so crappy compared to what they were when I started out, when they truly were not for profit, where you could have a social worker or a nurse in your house, where they could have ongoing conversations and their oncologist didn't get cut out. Now, when someone goes to hospice, they're not allowed to call their oncologist anymore because, well, who would be paying the bill and who would be getting paid and blah, blah, blah. Again, it's this weird structure because the hospice is for profit and they don't want a physician's bill to be mixed into it. And again, so that's the thing I think about. Like, if somebody had like a housing budget and they just got 30% back, that's a lot of money, right?
Yeah.
And thinking the same way about healthcare, right? Like, if we just took 30% more back, what could we do? We could do vision, we could do dental, we could do everything we want, and we could cover everybody. It's a kind of crazy process. And I do think it's really, really hard because people are so often in that situation of, do I get this test or do I buy my kid a computer? Do I get this or do I pay the rent? Do I do this or do I buy food? Like, those are not decisions that people should have to make. And you're right, like most of the world, not even the industrialized world, there's plenty of, in quote, less developed countries or less rich countries than us that believe in universal health care. It really doesn't make any sense to me. And, if we think education is something everyone is entitled to, and we think nobody's house should burn down, and that's why there's fire departments, like, why on earth would we not imagine that everybody's cancer should be prevented if we have the technology and everybody should be able to get their mammogram or their pap smear, or their colonoscopy or whatever?
So what you just brought up, why is it that we don't consider healthcare in a right like we consider other things? Like you said, we expect a firefighter to come and protect our house. We expect that the K-12 education is available for our children. Why don't we accept that healthcare is one of the most essential necessities that we need? Where did that happen, or why does that happen? What's your opinion on that?
I mean, honestly, I have no idea. It doesn't make any sense to me.
Yeah.
I think it's partially how the system is set up. I think it's partially because, we are a capitalist society, and the truth is, like, I'm glad somebody's making money off my iPhone because I like that it gets better every year. I like my iWatch, so I think we all have this inherent belief that we get better products because somebody's selling them to us.
Yeah.
And I think it's hard for us to imagine that that might not be true in healthcare. But the way I try to think about it and explain it is, don't you want your doctor to only be thinking about what's best for you, right?
Yeah.
That when you sit down with me and we're talking about your cancer, you want to know that I'm thinking about how are we going to get you the best longest life that we can get you, and that I'm only thinking about you when I say, let's do this surgery, let's use this medication, let's get this test.
Mm-hmm.
And it's really different than, when someone sells me a watch, that's a different ballgame.
Yeah.
But people want to know their doctor does not have some kind of conflict of interest, that I'm not worried about, well, I ordered too many PET scans this week, so I'm not going to order one for you.
Right.
Or, well, your pharmacy benefit manager won't cover this medication, so I won't even tell you about it, and I'll just move on to the second best medication and not tell you. Or that, like, there's some other, I'm making money off the 100 supplements I'm selling you, and so I'm going to recommend a zillion billion things that cost $1 zillion billion so I can, buy a new car or whatever I want to do. Like, nobody wants that from their doctor.
Yeah.
And nobody wants that from their nurse. Nobody wants that from anybody involved in their healthcare. And so that's how I try to make a distinction, that you don't want profit motives to be something that influences how somebody takes care of your life and death and your day-to-day quality of life.
Yeah.
And that's a piece that I don't know that people translate all the time.
Mm-hmm.
Right. And even then, like, let's even admit it, that even guys who make watches and make cars and all that stuff have to be regulated in some way. Right. Because sometimes maybe they make a decision that's profit over a safe car. But by and large, it's worked. And that has not worked in healthcare in any way. And the truth is, we have this big project right now looking at how do physicians and healthcare professionals feel about being tangled into that conflict of interest when their boss wants this and their bonus is this and blah, blah, blah. And they just want to take care of people. That's why they became doctors. Yeah. And that's why people leave the field, right? Yeah. Because that constant challenge it's really hard. When I started out as an oncologist, Medicare was still real Medicare, mm-hmm. right? So if someone came in and I looked down at the chart and I was like 65, all right. I don't have to worry about prior authorizations. I don't have to worry about any stupidness. I can just talk through what the best things are, and I'll be able to get someone to the operating room. We used to get people to the operating room within 3 days, wow. if that was appropriate for their cancer. Wow. We used to be able to get CAT scans the same day. We used to start chemo within 3 or 4 days. Now, like, it's an automatic 3 to 4 week wait. You see me in the office and I have to get prior authorization for every dumb step. And then, 1 out of 3 or 4 things gets denied. And then I have to make a bunch of phone calls and my staff is doing the same. And now we just accept that it might take 3 to 4 weeks to get someone to an operating room. Well, we know that decreases the chance of curing the cancer, right? Yeah. All this research says the shorter time between knowing you have a cancer and getting it treated is one of the pieces of being cured. And we just give it up. And honestly, it makes me nuts, but at some point I have to take a deep breath and just do the best I can in this system. But again, that's why I belong to PNHP. Yeah. But people don't know that, and people don't understand that. And somehow we've accepted it, yeah. Even as scientists, right? And medical people, we have no choice. We've accepted it because we're not making all the decisions anymore. Now, company CEOs are making the decisions about people's lives and quality of their life, and they don't know nothing about it.
Yeah, it's interesting when you said that about 65, because now we did a very first program was on Medicare Advantage, which brings us all back to the private insurance and the profit and the pre-auth and all the rest. But so what countries get it best? Well, if we were to look around the world, who are some of the countries that just seem to understand that healthcare is as basic as fire protection and education?
I think that there's good and bad things in a lot of countries out there, yeah. Right? We know that the Nordic countries, for a whole bunch of reasons, have the best longevity, have the lowest infant and maternal mortality rates. But even among those companies, there's different systems. Mm-hmm. The biggest piece, it seems, that's universal throughout is taking the profit motive out.
Okay.
And then there is a history part of it. And I think even in this country, among people like me who believe in not having profit in healthcare, there's some discussion about what would be the best way to do it. Do we need a system like Canada where it's just publicly provided? Or can we take all the hospitals and doctors we have and organize them in a way where there's a single insurance company? And that insurance company is the government essentially, or however we want to structure it. And then we have an administration like we have right now that makes me rethink trusting the Secretary of Health and Human Services, which I never imagined, that I wouldn't trust that that person would use science in the decisions they made. So, you know, I think all of the countries out there that choose to do it well. I think that there is the possibility that if we chose to do it, we could do it better than everybody else, because we could learn from the best of all the different systems that are there. Absolutely. And because we do have like an amazing, you know, university system, we have amazing other hospital systems that we could do it well. There's a whole bunch of things we do really poorly. We don't cover rural areas the way we should. We don't always prioritize prevention because we've gotten so fixated on thinking about diseases. So there's a lot of things that other countries do well, but there's a lot of things that little segments of our country does extremely well that I think that we could build our own system, and I think it would be the best. But I do think we have to think carefully through what are the resources we have, what are our real deficiencies, and how do we address those. And I think taking care of women, taking care of sort of historically marginalized populations, you know, meeting the healthcare needs of our rural communities, I think those are some major areas that we've missed.
Mm-hmm. Yeah, because right now, you know, we have Medicare, Medicaid, CHIP, the Affordable Care Act marketplace, employer health insurance, and veterans care. Those are kind of the biggest out there, but it's a lot of different components. And there's no question that, you know, in our office, Medicare and Social Security are two of the most popular programs that the federal government offers. And the leading proposal out there seems to be the Medicare for All proposal, which is a bill that essentially would expand Medicare for more people, but also expand the type of healthcare included. You know, what you talked about before, dental, vision, and hearing isn't included right now under Medicare, yet I don't think anyone would argue they're not healthcare. So what is the best path forward for the United States, in your opinion?
So the legislation you're talking about, the Medicare for All bill, big fan. You know, we were lucky enough to be involved in crafting it in many ways. And the fact that it attempts to take advantage of the good things that we have in our system, I think those are all worth it. I don't know the right way that we're going to get there. My personal belief is that as people understand that they deserve health care and start voting for their own health, that we could nationally decide that we're just going to offer everybody health care. I think we have to keep science in it. We have to have patients and physicians being part of advocacy groups that make the choices. We are lucky enough in the United States, almost all of the specialties have these groups that set up guidelines that help us think through the research and make good recommendations. I think it's time to, you know, actually be serious about people getting up and talking to their congressperson, talking to their senator about making universal health care available in America, free of profit motives. There are no conflicts of interest. And I don't think we're that far away.
Yeah.
I'm still struggling with some of the stuff that went down in December when a young man suffering from, I'm not sure if it's chronic pain or what happened to him, but he actually chose to shoot, you know, and kill somebody who's an administrator of one of these plans. And do I think the healthcare plans are evil? And do I think they steal our money and take it away from good healthcare? I do, but they're just doing their business. And I have not gotten over the fact that so many people felt like they were going to, in some way, celebrate what he did. And I think, how did we get here, right? How did we get here when regular Americans are so lost and so frustrated that they think that that's a reasonable thing to do. And how do we get to a place where we don't just take care of that young man who's having pain related to some surfing injury? I don't know the whole story, and so I shouldn't speak to it. I've certainly never dealt with him medically, and I'm a gynecologist, so he's never going to see me. But regardless, it's clear, right, that there was some trauma that happened to him to lead him to the extreme place that he got, and now he's essentially lost his life. He's sitting in a jail, and lost his freedom. We got to do it better. And I think the employer-based thing that you mentioned, it's ridiculous, right? That people should be how often does somebody not change their job because they don't want to lose their insurance?
Right.
How often does somebody who wants to start their own business or open their own bakery or do whatever not do it because their job is how their whole family gets insurance?
Mm-hmm.
That's stupid, right? And it harms small businesses. It harms creativity in America. It harms, mobility of people moving to wherever they feel comfortable, and wherever they want to be happy. I think it's a little challenging for me to think of us as a country that values capitalism and individualism and people, living out their dreams, that we literally tie them to an employer and a job that they might hate, but they're not going to leave because they got diagnosed with breast cancer or ovarian cancer, and now they can't do those things because they need their insurance. And, we haven't even talked about, I saw you had Rohit Chopra, who was talking about medical bankruptcy on, and that is, that's a whole, we could talk for an hour about that, right? The idea that people go into bankruptcy because they got sick. And most people who go into bankruptcy, they had insurance and they had a job.
Yeah.
Right. And then, there's people who I take
all your life played by the rules, right?
Oh, it's horrible. And then there's people who literally are struggling at what's likely the end of their life.
Yeah.
Right, where they have limited time left and they can't leave their job because that's how they're getting their cancer taken care of.
The Affordable Care Act, that was one thing that, we had heard from folks that now they could go start a business and, leave that employer. But even there, though, it's still the marketplace model. It's because there's a subsidy available to do that. Now, under the current administration, those subsidies a lot of them are going to go away, $300 billion worth. We were told a 60-year-old couple making $85,000 in my district on the Affordable Care Act, the increase under the bill would be about $16,000 a year. So, if you're doing an extra $1,200-$1,400 a month, you can't, right? And
you absolutely cannot.
Yeah, you don't have health care, or you're back into the problem of the medical debt and other issues.
And even the thing is, what might seem like small amounts of money, but they add up, right? If you're paying a $20 copay, but you have to show up 4 or 5 days a week, and if every single pill that you take, and suddenly you have a series of pills, and that's the hard part for me, right? I have friends, I myself participated in these trials to develop these medications to improve and lengthen people's lives, and now we've made them unaffordable to people.
Yeah,
it's kind of crazy making, really.
Take on just that aspect, because you brought it up a little bit before, and now again, prescription drugs. We pay more than any other country for prescription drugs. But
I take a big deep breath before I go into that topic.
Talk about it, because under a Medicare for All system, for example, versus the current system, you have buying power. You could have even better buying power. But there's some efficiencies and savings that aren't even related to profit that you can have by having a system that's universal for everyone, correct?
Absolutely. And I think there's just so much falsehood, right? The falsehood that pharmaceutical companies do most of the innovating. No, universities, National Institutes of Health, the National Cancer Institute, that's where most of the innovating happens. And there's even a false belief that somehow, if it wasn't hugely profitable, we would stop researching it, which, that's just not true. and clearly not true. And our system is so messed up. I'm not surprised, Congressman, that people don't trust all the time, right? Because we know that pharmaceutical companies have lied to us about the number of heart attacks that happen from a drug that people might be taking for arthritis. And they've done that because it's a for-profit endeavor and they were making zilliolas of dollars on it, right? And so that's why people don't trust us. And that's why every single day I got to talk somebody out of ivermectin, because I have a medicine that actually works for ovarian cancer, that's proven for ovarian cancer. And ivermectin probably makes some of my medications less effective because it's doing a whole bunch of other things in the body.
Yeah.
And so, I mean, I think it has to be built into the system that we do. And absolutely, we have to support innovation and we have to continue that work. And we have to reward the people who commit themselves to making people's lives longer and better.
Yeah.
But we don't have to make trillions of dollars, and we certainly don't have to create an environment where it's okay to steal and cheat and lie because you make so much money that you can just pay that little fine.
Yeah.
I mean, that's ridiculous. And we know that happens all the time, right? That nobody goes to jail even though they did things that killed people, that had they done it on the street,
Right.
Would be recognized. So we absolutely have to fix the way we do that. And the truth is, people think, oh, by keeping big pharma in it, by making it a high-tech endeavor, that we are getting the best we can possibly get. And the truth is, one of the reasons we haven't done a good job of settling once and for all, where does the marijuana plant help, and where is it in the scope of, can it help nausea related to chemo or not? And, what herbs are good out there and what nutraceuticals help. And we don't study them well because we've created this huge financially driven endeavor that's not about science anymore. And in America, it is very hard to get big trials done because it's become such big business.
Yeah, expensive.
So it's actually limited our ability to prove like the simplest things, right? You'd think like, there's marijuana all over the place. Like we should be able to say what's good, what's bad, what's dangerous, what's healthy. But we don't because, someone's already selling marijuana and they're making enough money, and I'm only going to put my investment into something that's going to make me $1 trillion. So I'm going to go for some high-tech medication, et cetera. And it's just created this completely distorted system where it's not what is the best thing for people to live the best, longest quality lives. It's such a not complicated concept that we've somehow made so complicated.
Yeah. Well, I know we couldn't talk about healthcare without talking about that aspect of it as well. So I wanted to make sure we brought that up. If you were talking to someone that you was about to talk to their policymaker, what's the strongest message about why we need a universal system? What would your strongest argument, your closing argument to someone to relay to an elected official?
I'm a physician. And so that's how I would think about it. I would talk to them about when has something happened to them that either caused them pain or challenged the longevity of someone in their family, and what was that experience like, right? Like I've torn a bunch of ligaments in my ankle. I love my ankle guy. He got me back hiking. He got me back into my real life. And that understanding of it's literally like the moment to moment way we exist. Let's not make huge profits off the worst days of people's lives. And let's make sure those best days, when they're having a baby, when they're like ringing the bell because their cancer is cured and they're done with their chemo, that those days are good and don't put them into debt for the rest of their life. Let's make a space where like no mom has to decide, do I get my kids a computer or whatever they need for school, or do I take my diabetes medicine? Nobody should make decisions like that. Right. And nobody has not had that experience where they interacted with some healthcare professional who saved their life, saved their quality of life, that's something everybody in America should have access to. And we can afford it. I mean, that's the hardest piece. The number of times I hear, and you know, like I said, PhD in cost analysis, right? Like all that money junk. I learned that stuff. And we used to always talk about there's a limited pool of resources and we're going to use our limited pool of resources effectively and efficiently, blah, blah, blah. Well, I will tell you, private equity sure doesn't think there's a limited pool of resources in pediatrics and OBGYN. Now they're taking over practices and they're making money off it.
Yeah.
That doesn't make any sense. I don't want someone to make money off not giving or giving my kid a vaccine. That doesn't make any sense.
Yeah.
So I guess I would try to appeal to a legislator's common sense, and I would try to appeal to their own humanity.
Yeah. I like the argument that you brought up, because I had not thought of it before, is just why do we even accept it? That you understand that education is available for your kids, that you've got police and fire protection. Why wouldn't healthcare be as exactly in the same categories? And if it's not, you know, what do we need to do to try to make it consider that? And I like that. That's a good way of looking at it and thinking about it.
And you know, back in the ACA days, I was not enthused because I felt like one of the big weaknesses of the ACA was that we just ended up giving more money to private insurance companies, and that we didn't do the right thing and make it a nonprofit endeavor and give it to everybody. We only still gave it to some people. But the one good thing, or several good things came of it, but one of the main good things I feel like that came of it was once people have healthcare, then they do feel like it should be theirs.
Yeah.
But it's right. It's hard to take it away from them. And that's why it's very interesting to me when people come from other countries where they don't understand how on earth we accept that.
Right.
When they come from a country where that's just something they always got as part of their, you know, the things they deserve, the things they were born to, right? The healthcare is a human right concept. And that maybe it sounds pie in the sky. To me, it sounds really basic.
No, I'm with you. I'm with you. So, Dr. Singh, how do people follow either you or follow your organization, Physicians for a National Health Program? What's some of the social
we have
media?
a nice website, PNHP.org. We're on everything. We're on Blue Sky. We're on Facebook. And then for lots of people, there'll be PNHPs in their state that they can find too. But to go to our website, and I'm sure your team has access to. We are doing a couple studies right now where we're looking at how financialization has made structural racism in healthcare worse, how it has made, you know, physician moral injury worse. And so for people who are in the health profession or who've been challenged by healthcare, they can find that study on our website too. And we're happy to have participants.
Great. I appreciate it. Thanks so much for being with us today and talking about healthcare and the need for a system, whether it be Medicare for all or something like that, a universal system like many countries have.
Absolutely. Thank you for talking about it. And thank you for introducing the concept to people.
Yeah, appreciate it.